Varicose veins have long thought to be just a cosmetic issue. However, varicose veins can actually signal a very serious medical condition. September is National Vascular Disease Awareness Month, so it's a good time to raise awareness about this condition, which impacts more than 30 million Americans, young and old. So Mickey is back now to tell us about a new solution. And Mickey, I understand even though this is fairly prevalent, this condition is actually usually undiagnosed.
Absolutely, and it's called chronic venous insufficiency, so we can just refer to it as CVI, and it develops when the valves that kind of keep blood going through the legs and back to the heart, they become diseased. And so it kind of, we know what a varicose vein looks like, and we've kind of all seen them, and there's certain risk factors, your family medical history, your age, but also your job. And that's why I have it on the back of my leg, is because I was a marathon runner, and that actually triggers it as well. And B, as a makeup artist, I stood for 12 to 16 hours a day. And I remember all the older makeup artists would say to me, honey, you need to wear some compression tights or you're gonna get veins in the back of your legs or on your legs or in your calves. And they would always say, don't cross your legs, don't cross your legs, because they had all done it before. But actually what's great is thankfully we have this new treatment to help keep, the varicose veins in check, but without showing, we're stuck in your busy schedule. So this right here is VenaSeal. And what this is it's the first of its kind approved medical adhesive from Medtronic, and it's available during the VenaSeal procedure. A small tube is inserted into the diseased vein, and a small amount of medical adhesive is used to seal the vein closed. Local anesthesia is not required after the treatment, and after the treatment, a single adhesive bandage, a Band-Aid, is basically placed over the access site, and patients are able to rapidly return to their normal activities.
So it's not surgery?
Traditionally, surgical stripping or thermal treatment options are used. Heat-based therapies require tumescent anesthesia, resulting in multiple painful needle pricks. That's not the case with VenaSeal.
Does it hurt?
Actually, that was the whole design behind this, is that they wanted to basically kind of keep minimal patient downtime, And what's great is, like I said, local anesthesia is not required, and that patients leave with a Band-Aid. So this is actually genius if you think about it. And what one of the doctors that we were talking to said is one of his patients actually went and returned and resumed to play golf that day.
Wow.
So it is really incredible and it's unbelievable. And so some of the symptoms that you'll find, when you're seeing these varicose veins is like leg pain. When you need this treatment, when you have CVI, some of the symptoms you'll find are varicose veins, leg pain, aching or cramping, legs or ankles swelling, leg heaviness and fatigue, skin changes or rashes, ulcers, open wounds or sores. So if you're having those, you could have the CVI. So talk to your doctor, and actually you can go on to VenaSeal.com and they have a physician finder where you can find a doctor that does this treatment. So minimally invasive. I mean, if you're in the past we've had so many other kind of options where we had those needle pricks, we had to have those thermal treatments, but this is basically you're leaving the office with that kind of minimal patient downtime.
Well, and it sounds like it's important to look into regardless, because I know I have one vein. I developed it from working out while pregnant. And I don't like it, it's ugly, but I've never wanted to do anything with it because I thought it just was gonna hurt too much and I was being vain. But it could possibly be a sign of a bigger problem. So if you have a vein and any of those symptoms.
It's not just an aesthetic issue. I think we look at it as like, oh, it's an aesthetic issue, but the truth is that there could be this underlying health issue behind it, like CVI.
And how common is it? Common?
30 million Americans, and it can be young or old. You definitely do see things, age does have a factor within those risk factors, but honestly, it's something to definitely get checked out because it's not just an aesthetic thing, it is a health concern.
All right, well, good thing to alert us about, so we appreciate that as part of Vascular Awareness Month. And remember, for more information, you can visit that physician finder at VenaSeal.com. All right, thanks, Mickey. And coming up next, we're going to talk to Chef Julio Hazan about a new book in his family. Stay with us.